Hello everyone, my name is Dr. Chaitra S. Niranthar, obstetrician and gynecologist working in the Department of Reproductive Immunology from Parva Diagnostics and Healthcare, Bangalore. May 10th is World Lupus Day. Lupus, an autoimmune condition wherein the immune system becomes hyperactive and starts attacking its own healthy tissues. Because of its complex nature, this is called a disease with 1,000 faces. There are multiple forms of lupus: systemic lupus erythematosus, discoid lupus or cutaneous lupus, drug-induced lupus, neonatal lupus. The commonest of which, 70%, is SLE or systemic lupus erythematosus. As the name itself says, systemic. Multiple organs are involved in this. SLE has a very vague symptom: fatigue, muscle pain, lethargy, headache, unknown causes for hair loss, malar rash, a rash which is in the shape of a butterfly on the nose and on to the cheeks. So very vague symptoms. So it becomes essential for a person who is experiencing such symptoms to visit an immunologist or rheumatologist. Being an obstetrician, most of the time the common question I get asked is, I have lupus and want to have a baby. Well, is it safe? Yes, most of the time it is safe. But you have to keep in mind that you are in the remission phase, which means your disease is not active per se for the past 6 months, wherein your pregnancy will have a good outcome. If you conceive in your active phase of disease, what happens is there are high chances of miscarriages or stillbirths. Also, we have to always keep in mind that SLE by itself comes into the high risk category. These people who have associated high blood pressure or pre-existing heart or kidney problems will fall into the category of a high-risk pregnancy. And the next common things what people want to ask, and nowadays especially because women are more concerned about their health, which is I'm very happy to say, is how does pregnancy affect lupus? There are some changes which will be seen, especially in a woman with lupus. In the first and the second trimester, she may experience some flare, which is easily managed. Most of the time it's mild, but sometimes it may be a little difficult and her medication may be changed, or she may also land up having an early delivery. 2 in 10 women who have lupus will also develop preeclampsia. It's a condition in which there is an elevated blood pressure and protein starts leaking in the urine. A woman will experience symptoms like bloating, swelling of the legs and hands. She may have blurring of vision, upper abdominal pain. So it becomes essential for you to be in touch with your immunologist as well as your obstetrician through and through. Also, because a woman with SLE or lupus will be having certain medications in the form of steroids which will have its own effect on her. The next common things in which I usually like to insist and talk about is how can a pregnant woman say that she is having an SLE flare, or is it just a pregnancy? Well, you can't. So make sure that you are in constant touch with your obstetrician and immunologist. Always be in touch with both of them. Your medication may be changed a little bit in your pregnancy depending on your status. Certain blood tests will be done to make sure that you are in your best state possible. The most common question, and most of the mothers have their fingers crossed when they ask this question, is I have lupus, will my baby have lupus or will my baby get affected? Well, very happily I would like to say most of the time no, the baby do not get affected because we are constantly monitoring you. Sometimes these antibodies may cross the placenta and may go to the baby and cause conductive cardiac defect, and that becomes essential for you mothers to know, and that is the main reason why you kind of women will be asked to do repeated scans to make sure that the baby inside the womb is not affected by the antibodies present in you. And if we start noticing certain changes, we will have to change your medications. Neonatal lupus is a condition wherein we see in newborns, because of the antibodies which is present in mother, would have crossed the placenta, and the changes which we see in the babies will be skin rashes or liver dysfunction, or blood cells will be sort of low. These kind of babies usually recover within 3 to 6 months with appropriate therapy. But yes, the baby will be monitored and an echo will be conducted to see if there's any conductive cardiac defects. And the final question is, can I breastfeed my child? Yes. Most of the time, the women who are SLE and pregnant will be in their remission phase, so will not cause any problem. So you will be in the milder form of medications, which is safe in pregnancy and breastfeeding. So on this day, I would like to inform all my women who are diagnosed with lupus, do not be disturbed. There is always a phase. SLE has a remission, it has its active phase. I do understand. But having said that, over a period of time when things are settled, you can plan your pregnancy and have a safe pregnancy. Namaste.